Starting up here. Hi everybody, welcome. My name is Brian Layton. I'm the Assistant County Manager. We're here with Chief Joe Shelley of the Shelley Police Department.
Hi,
Chief.
good afternoon.
And also Tracy, right?
Yeah, I'm Tracy Uliberry, part of Pediatric Multicare West. I am one of the pediatric nurse practitioners.
Awesome.
And you're going to be nice to me.
I am going to be super nice to you.
Okay, good.
And Chief, what are we doing here today with you?
This is my second shot. This is my COVID-19 second shot, so I'm looking forward to getting it and doing my part to curb the pandemic that's been going on and actually ravaging the nation for the last 14, 16 months.
Yeah.
Crazy. So
awesome.
This is my part.
Well, I appreciate you being willing to experience this with us. So Tracy, how does this work? How does the second dose go here?
So it is a super quick little vaccine. It takes probably maybe 5 seconds to give. And then we have you guys wait around 15 minutes, make sure there's no adverse reactions, and that's about it.
Okay, well let's stick him then.
I like the 5-second rule. That's a really good rule.
You follow that rule at home, Chief?
5 seconds.
Okay.
Any longer than that?
All right, you ready?
Sure.
Count 3. 1, 2, 3.
I don't even feel it. Not at all. You guys need to take some lessons for this. The fire department is here, by the way. So, okay.
Okay, so that's it for the dose.
That's it for the dose, and then we have them wait around about 15 minutes to make sure there's no adverse reactions, no dizziness, no headaches, no shortness of breath. And then after that 15 minutes, we are good to go.
Okay, well, awesome. Also joining us here today, we have Cathy Solomon. Hi, Cathy.
Hi.
Cathy's one of our infectious disease nurses for Navajo County. Cathy, how long have you been with?
The county?
Yeah.
Almost 9 years now.
Okay, and you've been knee deep in COVID
For all of those
since the
16
start.
months.
Yeah.
Exactly.
Yes.
Okay. And so right now, like, what is your primary role here? What are you doing, kind of day to day with the COVID and the county's response?
We are continuing on with our contact tracing and right now focusing on the vaccination campaign, trying to get some herd immunity going to decrease and prevent the spread of COVID in our county.
Okay. So one of the big questions we're getting over and over again online is, what kind of efficacy does the second dose offer? Like, I guess, why is it so important to receive both of these doses?
Okay. I'll just kind of start with the basics, and that is that these vaccines have received emergency use authorizations, and to be able to get that they went through specific studies, and these studies are done with parameters, and so the emergency use authorization follows those. That is the information that's out there since they're still pretty new. So they don't really agree on how much efficacy the first dose has, somewhere between 50 and 80, depending on the subsequent independent studies that have been done. But when you get your second dose, it boosts you up to the efficacy rate of, for the Moderna, which is what you just received, it's 94.1%, which is actually very good for a vaccine.
Okay, awesome. So that second dose that's really important, right?
It is. That's
Okay.
That's the way it was studied as far as we know, because of the information out there and how it was done. That is the only way to get up to the 94.1%.
And what was the normal wait time between these doses? And up here we use the Moderna vaccine, right?
Yes, Pfizer is the other vaccine that Arizona has, and it requires some pretty intense temperatures to be able to keep it viable. So we can only really use the Moderna, which is just as good. They're on par the same kind of vaccine. And the Moderna was studied with 28 days in between each dose. The Pfizer was 21, so you might hear both, but for us in Navajo County, it's the 28 days in between. That being said, it was also studied up to the parameters of you can go at an extra 6 weeks between the first dose and the second dose and still reach those efficacy rates.
Okay, so if someone misses their appointment, they don't miss out on a chance to really get vaccinated here, but they should go in as soon as they can, right? Within that 28 days.
Yes, correct. So for instance, this week, the vaccine allotments that we're getting from the state are a little bit late due to weather in the Midwest and so forth, which is where the vaccine ships from. So there might be some individuals who aren't going to be able to get the second dose on the 28th day just because the vaccine hasn't made it here yet. Again, that's not a huge deal because you'll still fit in the window if you get a little bit later, but it was studied at 28 days and that is what is preferred.
Okay. Now let's talk about side effects. And Chief, how are you feeling so far?
So far, so good. Except I thought he was a firefighter, but I'm not sure yet.
Do you want to introduce our guest here?
It's actually Mrs. Dousfire came down to make sure I was doing okay today. So.
And your assessment?
So, this is great information. And I'm like, oh my Lanta, I think I need to get the shot.
I'll trade. Come on over. No.
Thanks. Side effects.
There are some side effects, especially after the second dose. The reason for that is the first dose started you making antibodies to it, and so when your body recognizes the second dose, it responds more, and so you're more apt to get side effects with your second dose than you were with your first. The most common side effects would be a sore arm or pain at the injection site, being tired, more tired than usual, fatigue. Another one is the headache, and sometimes you can even get the fever. There are some others, but those are the most common ones. Usually those will go away within a few days at the most.
Okay, so what should Chief Shelley do if he starts experiencing some of those symptoms later today?
Headache medication, Tylenol, anti-inflammatories, resting, those kinds of things. I think Mrs. Dousfire has agreed to go over and take care of you should you be in bed. Not kidding. No, there are individuals who do have a strong immune response sometimes to it, and so sometimes you hear about people who were in bed with fever and chills and stuff like that. It can happen. It does not mean that you got COVID. It means that your body is mounting a good immune response to the vaccine.
And Tracy, what are you seeing here as a provider? Are you seeing other side effects from the vaccine?
We actually really have not seen that many side effects. We have a little bit of headaches, a little bit fatigue. We've had a couple people have small fevers for about a day or so, but that's about it. We haven't had any real side effects.
Okay, awesome. And some people are commenting here, what do they do how do they go about getting that second dose? How do they sign up for that?
The way that the vaccine is allotted is we get our doses from the state, and then the county allots the doses out to the different facilities that have onboarded for the program to be able to vaccinate. We make sure that 4 weeks after, those facilities get the same amount of dosage for the second vaccines, and then they get a few more for the first vaccines. So it's really, really helpful if you go back to the same place you got your first dose at, because that's where your vaccine was allotted to. So the same way you got your first appointment, you would go in to get your second appointment, whether that was the online registration or the phone call or however that facility had it set up.
Okay, so if someone's gotten their first dose, we should have a second dose for them because that's how we plan it out and distribute it.
Navajo County has tried very hard to do that, and so far we have been able to do that. The CDC and the state of Arizona is not guaranteeing second doses, but we feel that it's important, and it was a promise that was made, so we're doing everything we can to hold to that.
Okay, awesome. What can you tell us kind of generally about the vaccine availability here off tribal lands in Navajo County?
We are being told by the state that they make allotments according to population size and a few other variables, such as how many people do fit into the demographic area of, say, the 65 plus, because that's who's being vaccinated right now, those kinds of things. And so we get our vaccine allotment based on that size and that's how we receive ours. Everywhere is having problems getting enough vaccine. The demand is bigger than the supply right now.
We don't get as many as we ask for, right?
No, definitely not.
Okay.
No. So, which is a good thing because that means that interest is there, but we also need a little patience to be able to get the vaccine. We are dispersing it very well in Navajo County, and so far we've gotten like 16% vaccinated, which is higher than the state's been doing for their population, so we feel pretty good about that. But yeah, the only thing really holding us back is the amount of vaccine that we are able to get.
Okay. And Chief, you still feeling okay?
Feeling great.
Okay.
All I can say is don't stop going to the website and doing that and trying to log on to the system and stuff and try to get the appointment. It's out there. You just have to get on there, and because some appointments they free up or people can't go to them. So there are appointments out there you can get on to. So just keep trying.
Okay.
They can also call the county libraries if they're having difficulty signing up online, and they've got individuals there who will help you get an appointment.
Yeah.
And at the senior centers as well.
Correct.
They can help you out. And somebody just asked about if we're going to do a drive-through site. And as of right now, we're not planning on that, right? Because we have a ton of great providers that are willing and providing it, right?
That is correct. We see that in the future, but we can't do the pods, point of dispensing, the drive-through pods is what we call them, until we get enough vaccine to be able to keep it up, because otherwise we wouldn't be able to give out enough at that. So it is in the future, but not at this time. Our
We just have to have
providers
enough. We have to have
Yes.
enough vaccines to do it. As of right now, our providers are handling all the
They're
vaccines
doing
that we're
great.
getting. Okay. Okay, fantastic. Mrs. Doubtfire, any parting words for us here?
Just stay safe and wear your mask.
Thanks, everybody. Cathy, Chief, Tracy, thank you very much for joining us.
All right.
Appreciate it.